Okay, let's get to our next guest. A Quebec company is launching a service that will give access to a doctor on demand for just $15 a month. Carl Guérard is the Chief Operating Officer at Olive. Hi, Carl.
Good morning, Elias.
So let's talk about this. I think access to healthcare has always been an issue. I know there are a ton of apps that now exist that allow you to do, FaceTime or, video calls with doctors and get care. But the one thing about them is they're often tied to your healthcare plan at work, and it's not for everybody. Olive is different, isn't it? It's not the exact same thing.
Yeah, exactly. And thanks for having me on the show. Olive is a virtual clinic that's accessible from the good old digital stores, whether it's the App Store with the iPhone or Google Play Store with Android. And it's accessible to all Quebecers. And it's through a plan that is only a couple of dollars per month. And the idea is to put you in contact with practitioners right off the bat through a teleconference call right on the application.
Mm-hmm. Okay, you mentioned a couple of dollars, but I want to be precise here. So how much does it cost per month for the service?
Yeah, for individual plan, it's $15 per month plus taxes. And for a family of party of four, it's $39 per month plus taxes.
Okay, so take me through this. Would you say this is targeted at someone that doesn't have a family doctor, and now for like you said, $15 a month for an individual plan, can now get access to that kind of care?
Yeah, and Olive does not replace the family doctor, but it's an alternative. So just imagine it's Saturday night, mother with kids, and the old kid is not feeling good. This is perfect for those individuals that want to have access right away, 24 hours, to a nurse or a primary health care nurse practitioner, because these practitioners have more power now in the province of Quebec. And then that person could be transferred to a physician right after that, depending on the need. So the family doctor could later on get the results of that consultation. So this is really to get access to health for all people in Quebec as fast as possible, and with, like I said, a FaceTime contact, because we believe that once you are not feeling well, the first contact you want to have is a human touch. You want to have a nurse that talks to you right away, or a doctor. So that's the principle of our approach. And again, we want to make it available to as many Quebecers as possible.
And we're with Carl Guérard. He's a Chief Operating Officer at Olive, a new healthcare app offering on-demand access to a doctor, $15 a month. Now, Carl, does this then? You need a RAM queue, right? Do you need a Medicare card? And it's being billed to the Quebec government, the actual visits that you have. Like, who's paying for it at the end of the day? Because I'm trying to figure out how $15 a month could possibly cover the whole bill.
Yeah, and we're in for the long run. The first reaction would be to say, wow, $15 is not much. Again, our profit will be based on a few years from now. But the idea, we pay our professionals for the service that they provide to the customer. So that has nothing to do with the governmental healthcare. We do ask for the card for identification purposes. So people pay for a membership fee that has access to teleconsultation or different features on the app, including the emergency rescue, and I'll be able to talk about that. And we pay our practitioners. So then we're completely private from the health solution from the government.
But Carl, you just brought it up, the emergency stuff there, because you have a history when it comes to healthcare in Quebec, and it has to do with sort of emergency response, right?
Yeah, exactly. Olive is a startup company, but our sister company is called Paramedic. Paramedic specialty is to provide emergency medical response by helicopter or by plane. So we've been watching, over the past couple of years, the tendency in, using technology to facilitate the contact with individuals. As a matter of fact, people were calling our emergency dispatch just to get advice. And since the pandemic, it really confirmed the need to have us work on a solution. So we really worked hard for the past 10 months to make this available. So on the app, there's an emergency button. So if someone, is an emergency situation, whether it's after an accident or someone is not feeling well, presses the button and puts the communication directly with the airmedic dispatch center that's in operation 24/7. And the dispatch center will decide whether it's going to be a ground vehicle or an air vehicle that's going to do the intervention based on the person's location.
Carl, when we talk about using your app, Olive, what is the wait time? Like, how does it work if I open up the app? How long between me saying, hey, I'd like to speak to a doctor to the time where you get to actually speak to someone?
Yeah, the idea is as soon as you press on the teleconsultation button, we want to make the link ASAP. So it's a question of a couple of seconds. But first, you will speak to a nurse. The nurse will understand and will evaluate, and then will either resolve the issue or will use another practitioner, whether it's a primary healthcare nurse or a physician, to do the rest. There are certain limitations in terms of telemedicine. If there's a need for a patient to visit a clinic after that, we have care coordinators that will make the appointments. They'll do all the phone calls for you, whether it's private or public, to make sure that we offer an end-to-end solution. So really, it's a peace of mind, and we want to be able to assist as much as possible with our service.
And just to be clear, we've got to wrap up here, Carl, but the cost for the user, it's that $15 a month cost, and that's it?
Yes, and it's unlimited teleconsultations, no contract, and no engagement. So it's $15. As soon as you enter your information in the app, you provide a credit card number, and the billing starts, and it's unlimited.
Carl, it's a very interesting idea, especially here in Quebec. I am very interested to see how this plays out as you are a startup. So thanks for coming on the show. Great initiative here. I am genuinely interested to see how this rolls out over the next couple of years.
Yes, and for more details, we have our website, olivemedic.ca, for all the information you need.
All right, that's Carl Guérard, Chief Operating Officer of Olive.